Hello everyone,
I will show you
how to use Surgical Guide Studio guides for an edentulous old patient that has no teeth and she would like to have implants in the upper and lower jaw and immediate loaded teeth. So the protocol for this case will go with the maxillary jaw. It must be started with the maxillary jaw. We have the base guide and we have the index. The index is the patient's existing denture, the scan appliance. We converted it to teeth, denture teeth, and we have bone legs. Stack these together, the base guide and the index, and then you go seat it onto the edentulous maxilla, the flapped edentulous maxilla, and once it's seated and verified in position, you pin the base guide. Once the base guide is pinned, then all you have to do is remove the index and reduce the bone to the level of the base guide. Once this is accomplished, then you go place the implants through the implant placement guide, and the implant placement guide has indentation marks. These indentation marks to guide the timing of the implants. These two implants in the premolar sides will have angled multi-unit abutments. However, we made timing marks in the front just in case to idealize them, and in case in the future the doctor would like to retract the teeth back, then he can retrocline the teeth. Now the multi-units can be inserted, and the angled multi-units have timing marks on the base guide, and also the other implant positions can be tweaked through the timing marks on the base guide. So double marks on the implant guide and the base guide, and they coincide. And then all you gotta do is just place the temporary cylinders and you are ready for the conversion. For the conversion, we have our prosthesis. We have two ready-made prosthetics for the upper and lower jaw. And we send also another replica, and we also send two carriers. So this is the carrier. All you gotta do is just seat it into position, and you hear the click, and you have buccal holes for the conversion. And then you go seat it through the temporary cylinders onto the base guide, and voila, now you are ready to convert the case through the buccal holes that you could see over here. And once the pickup is completed, then you're done with the maxillary jaw. And then when we go to the mandibular jaw, the first thing you're gonna start with is the same protocol. You have the base guide and you have the index, which is the future prosthesis, the same hybrid as this that will include to the converted maxillary prosthesis. And all you gotta do is just seat it into position, and you can see it has bone legs also. And then you can go to Instagram and check our account. We have pictures for this case. And then you go seat it onto the mandible, and you can have the patient to bite also. So you could see that they coincide in occlusion. And once your patient bites with the converted maxillary prosthesis, you pin the mandibular base guide. And once it's pinned, just remove the index, reduce the bone according to the guide, and you can see it's notched in the distal areas just to avoid injury to the mental foramen and the mental nerve. And then once you're done with bone reduction, then you are ready to start placing your implants through the implant placement guide that has timing marks on the distally 30-degree angled implants. And here you go, you place your implants according to the timing. And once you are done with that, all you gotta do is place your multi-unit abutments. And once they are done in position, you go place the temporary cylinders, and then you have the pickup prosthesis, and you get two carriers for each jaw. As we mentioned, you just seat it into its carrier, and you hear the click. Done, it's in position, and it has also buccal holes for the conversion. And then all you gotta do is just, this is the clinical scenario, and then all you gotta do is just get it, and then you convert through the buccal holes as you could see them over here. And you can also have the patient bite or not, and voila, you're done with the case. If this patient will not have immediate loaded prosthetics, you decided that during the surgery, we also gave you spare dentures that exactly a replica of the conversion prosthetics. These are the conversion prosthetics, and you could see that they have buckle holes for the conversion, and they have pre-drilled holes, so you waste no time during surgery and you deliver smiles to your patients as you promised.